Did you know your brain relies a great deal on the input from your eyes? What happens if your eyes and your brain don't talk efficiently? How does that affect your perception of your world? Well, Dr. Nick, also known as Dr. Stel Nikolakakis, is here to join us to talk about neurovision therapy. And he has a practice in Toronto, Ontario, Canada called Mind's Eye Optometry in Toronto. And Dr. Nick is also a breakthrough coach with drnick.ca. Stel, my friend, thanks for joining me today to talk about this.
Thanks, Andre. It's a pleasure being on this call. I've been waiting for this for a while. I'm excited.
Yeah, it has been a while, but that's okay. We finally got it to work. How big of a role does vision play with our brain processing, and how does that affect our perception? Because that's the biggest thing I got from you was about perceptions.
Yeah, so I'll just start with a little bit of history in terms of, where I was and what my definition of vision used to be and where my model of vision or my definition of vision is now, because it'll help explain to the listeners something that is somewhat intangible, make it tangible. As you mentioned, I'm trained as an optometrist by profession. We have a child that has cerebral palsy, and it was actually a colleague of mine that thought it would be a good idea to have him go through vision therapy, as it would support his development. And the way that he noticed it was in his body positioning, which I found strange. I'm thinking, what does the body have to do with eyesight and vision and being an optometrist? Trying to explain to me what it was. I didn't really understand, but anything that's going to help my child or my family, I'm all for it. So then I went to the States to learn. And then that's when I found out that, yes, I can support my child with understanding what vision is, which is actually the connection of how the eyes and the brain function with each other. And because of the brain is what creates movement. So if the eyes and the brain are connected, then what we visualize actually creates some type of movement or motion. And it significantly helped my son. And then the other thing that I found, and why I'm excited to do this podcast with you, is that, this is the statistic, I think it's low, but 25% of every classroom has some type of vision-related learning disability. Mm-hmm. And that also includes diagnosis of attention deficit disorder, or ADD. And as it's one of your passions, I was excited.
Dyslexia as well, right?
Dyslexia, well, it's a form of dyslexia, but
okay.
Yeah, any type of vision-related learning difficulty. And after speaking to you and connecting with you and finding out your passion with ADD, and some of the conversations that we've had around how vision connects to ADD is why the main reason I get excited to get on your podcast, so that we can share a message that I'm hoping can support a lot of people. So we'll start there, and then if you have any questions, then we can.
Cool. So what is neurovision therapy, Stel?
Okay, so the best way for me to describe it is to explain the visual system in terms of the hardware of it and then the software of it. The hardware is basically, how do the eyes point, how do they focus, and how do they move, for example, when someone's reading. Yeah. Okay. And then we look for any inefficiencies in any of those three systems, because if we don't have efficiency there, you'll hear a child saying, I need to reread what I'm reading, or I skip lines, or I use my finger, that type of thing. Okay.
I bet you a lot of listeners are saying, yep, makes sense.
Yeah. And it's 25% of every classroom will pick these things up, right? Where, the child sees 20/20 from a sight standpoint, but we don't think to look and say, how is the system taking in this information in order for us to be able to, right, to read, right? In this case. So the second part is the software of the visual system. So once it goes into the brain, how does the brain, take the information and put meaning to it? Like, what does it mean to understand what it is that I am reading? And again, we look for different areas that may not have developed or are inefficient, and then basically train those areas, or create, again, neuroplasticities where it comes in, but new neurons, in order for then there to be an efficiency in the system.
Right.
Okay. But the key piece here is, how do the brain and the eyes connect with each other so that there's a way for movement to occur? It goes back, right? Because it could be when you're reading something, does it make you move? If it's a story that you're reading that's emotional, right? If I don't understand it, then yeah, I'm not gonna get moved by it. It doesn't mean anything to me, right? So that's why sometimes children with issues with reading, they'll read it, but they don't necessarily understand it, and the level of understanding will depend on how the whole system's functioning.
Comprehension.
Big time. It's the number one question that I ask. When you read, do you understand what you read? Because comprehension is the first thing that gets impacted.
Hmm. Yeah. Yeah. So what is this correct? In my eyes, if I got a prescription from an optometrist so I can read, that means I'm just seeing better. But what
Yes.
you're saying, there's an actual connection or possible disconnection between what I'm seeing versus what the brain is processing, which you said creating meaning.
Yes.
So I can have a prescription to read so I can see better,
Yeah.
but the comprehension, the creation of meaning between the eyes and the brain can be lost, because this is sounding very familiar with me. And to be completely honest with the listeners, I have gone through this neurovision treatment assessment with Stel and his team. And the reading comprehension thing is what blew me out of the water. I could not read fast. I thought I was dyslexic because I swear I was reading 5 times slower than everyone else until I got these glasses. Now, these glasses are not a lens. They're called prisms, right?
Yes.
So,
we call them neurovisual balancing lenses.
okay. So how's that different from your standard prescription glasses?
Yeah.
And what does that do?
Yeah, it's a great question. So in terms of what we see, okay, and one of the things that we need to do as optometrists is evaluate what's the visual acuity. How well does somebody see on a scale of 20/20, 20/25, right?
Right.
So the first thing we look at is central vision. Okay, and then we say, how well do we see, 20/20, 20/40, for example, and this person needs and is nearsighted, needs a nearsighted lens in order to see clearly.
Right.
Okay, and it's important. It's not that it's not important, it's important. But I'll give an example of, say a child comes in with attention deficit as the diagnosis. Okay. I want to know what that child sees, but let's assume it's 20/20. And then the eye is perfectly healthy. Then we make the assumption that everything's fantastic and vision is fine. You can't make that assumption without a little bit of a further evaluation in trying to understand how much of that child's peripheral vision is getting utilized by the brain.
Peripheral.
Okay? Peripheral. Now we're talking peripheral vision. Okay, so if I say to anybody, including the listeners, what do you think is more important, central vision or peripheral vision?
I'm going to say central. That's what I think.
Right? Because that's right? We
Right.
know it because it's something that we can see. Peripheral vision tends to be a little bit, again, more of an intangible in terms of, well, but how do I know that I'm using peripheral? What am I using? How does it get utilized? And if I can, I'll explain right now what happens. So if we think of how much information is around us all the time, it's an exorbitant amount. We can't possibly take it in, our brains are going to explode. Okay, so this is now the perception thing that you talked about before. How we perceive the world depends on what's going on in terms of our internal representations or what we've been exposed to in the past or the state that we're in. Okay, so if we're in a very anxious state and we view the world from an anxiety standpoint, the brain says, hey, let's shut down the noise. Okay, let's shut down the peripheral vision so we don't get confused, because we may need to leave and exit this representation quickly.
So just for the listeners, he's putting on his hands and narrowing into a circle for reducing the peripheral. Right.
Exactly. So think of it like tunnel vision. Like I'm actually creating tunnel vision because that's the way the sympathetic response works, or my fight or flight response is in everybody is a constriction of the periphery so that we can focus centrally in order to basically escape a lion that's chasing us neurologically. That's what's going on in our heads.
So it's your brain protecting you.
100%. Everything is a positive response. That's why whenever I discuss things with parents or a child, I'm always looking at the potential, and everything happens for us, not to us. So here's a situation where there's a protective mechanism to be able to run if we need to.
Right. So it's
Okay.
like I've said many times, your brain will do whatever it can to protect you, and it does not know the difference between a maladaptive practice or a positive practice. So this is very interesting. So narrowing of the field, reducing the peripherals so I don't get spooked, and being a little more tunnel vision or central vision is a protection mechanism.
Yes. Okay. And again, I could speak from a personal standpoint because probably when I was younger, I would have got diagnosed with ADD. Okay. But it made me a really, really good football and rugby player, like really good. Why? Because I knew exactly where to hit and tackle.
Right.
I knew exactly how to catch the ball when it was coming at me because it was coming directly at me. Right. So you look at it from a perspective of saying, look, it was a supportive mechanism. Now, the most supportive mechanism is when you have choice or flexibility. Okay, so what do we do with neurovisual lenses? If we see a let me backtrack 1 second. So think of how would a child read if there was a constriction of the periphery? So central vision is aware. It sounds like this because I only see one word at a time.
And I would repeat, go back, go forward myself. What I noticed, I kept scanning up and around.
I just skipped a line and didn't realize because, okay.
Yeah.
So that's what it looks like. So now, in terms of how's my brain going to process that information, I'm focusing so much on where's the next word. And I just forgot what the last one was that I have to repeat myself or say it out loud in order for the information to go in auditorily, or walk around the room, because then my kinesthetic body, I know where I am in space, which automatically will help open up my peripheral vision and awareness.
Right.
Okay. So again, going back to behavior. Okay, let me just extend a little bit, and then I'll come back to the lens. We call it behavioral optometry because we're paying attention to the full behavior of that patient or that child.
Not just worrying about what I can see.
I'm not just worrying about what I can see. I'm trying to understand what's going on neurologically. So if there's a constriction of the periphery, there's no awareness of their body. So I'm looking for foot tapping. I'm looking for fidgeting. I'm looking for movement in their hands, because all of these allow the brain to know where the body is so that I can focus on the task at hand. So a lot of the times in training, we'll give a child a fidget tool to play with, because then they can think better.
Oh, yeah.
And thinking is a visual exercise as well. Okay.
Oh, thinking is a visual exercise.
100%.
Keep going.
Okay. And by the way, it's a big visual exercise, because we know that, 60 to 70% of the brain is actually visual. Okay. So if we can stimulate that visual processing, which is pervasive in everything that we do, then we'll be able to think more effectively.
Right.
Back to the lenses. If we put a lens that provides space or opens up the periphery on a patient or a child that has only central available to them, now what happens is the reading moves more to 2 words or 3 words at a time, to be able to not have to worry about where they're looking, and the comprehension improves, their confidence goes up, and now they can understand a little bit more. Okay.
Yeah.
So what do you think happens to the meaning if my brain isn't occupied in trying to understand how to read, as opposed to, wow, something's in there, so I can put the energy towards what it means in terms of what I'm reading?
Right. Yep. Yeah. Like
One
to
more thing I need to add, Andre, that's important is it sounds like it's a simple strategy. It's not. We need to find the lens that's going to provide the most amount of safety for that brain to open up at the level that it's ready to open up to.
Right. Can you go more on that? What do you mean by that?
What's that?
Can you expand more about that? You want to do carefully so it doesn't overwhelm the
So
brain?
safety to me is a key point I always try to make. And because it sounds like it's a simple process in the way that I'm discussing it, But if the brain is so used to being a certain way for many, many years, to open up the space too much for the neurology to kick in is overwhelming.
Yes.
Because remember what you said, it's a protective mechanism. It did it for a reason, right? So now, how do we open it up so that we still respect why it happened for them and to give them flexibility and space to see or to provide the visual processing a little bit differently to then give them an idea of what's possible. And that's why I always talk about what's the potentiality. Okay. Now, just to throw it over to you, because you work with entrepreneurs, high level entrepreneurs, and a lot of them have ADD tendencies, right? So then you say, well, if they didn't have the problem, would they be as successful as they are right now? Right. So now
It'd be way better.
Right.
Yeah.
Could the problem or the biggest issue in their lives actually lead them to the biggest opportunities? And now how do we move the opportunities to help them understand now what's your purpose and how do you help other people? How do you make a bigger impact? And
and that's huge, because what the other question I do want to ask, like, you're talking about narrowing the vision. And in my case, you said you needed to open me up and to ground me. So what would be that difference? I think everyone can visually understand the narrowing the periphery, because I got a couple anecdotes about that one, and then the safety aspect. But what about the other way? You're opening me up is what you explained to me.
Yeah. So,
more?
Yeah, like if you think about, you're a very big thinker.
Yeah.
Okay. Very creative, very big thinker. You see opportunities, like you're going to think outside the box, right? You have more access to things where people are going to ask, well, let me ask, don't people ask you, how did you come up with that idea?
All the time. Yeah.
All the time, right? Like, how do you do all the things that you do? It's impressive, right? And then you share a concept, which I've been on the receiving end of, where it stimulates my thinking going, where the heck did you just come up with that idea? You just made me realize something. And then as I'm speaking, you're receiving it at a level that's much higher than most people are going to receive it. And that's why we can have these depth of conversation with that. Okay.
Yeah.
Now, the way, and I'm in this space with you too, like when you're such a big thinker, a lot of people don't understand you and they'll say, can you make this real for me so that I can understand it? You know, can you please yourself, because you're all over the place, right? And if you think about this as a metaphor, right? If you're grabbing things from the sky, these thoughts from the sky, and you're loving it so much that you're in the sky a lot because that's your happy place, what's the easiest way to ground you? Right? We take what we call base up prisms, which brings your upper world to a grounded level, and now you're in your body. Okay. And for you, it was like, what on earth? This feels weird. It feels different. But now you have access to how do you ground the thoughts at the same way of your unique ability to grab those thoughts and make it real for everybody else. And what it looks like, a podcast like this, right? It's a grounded mechanism, but I hope that explains it, but there's different ways.
It does. It's very well. And then what I want to go back now is about the lenses creating safety, and you want to do that carefully. So my daughter went through the same thing, and her issue was periphery, very powerful peripheries. And without a word of a lie, you warned me what she was going to say. And we're driving home. She didn't have those glasses on, those prisms on for more than 10 minutes. And she goes, I don't like this. I'm like, why? Because I can see you. And we're driving. So I'm like, I know what she means, because she was looking straight. So she had her peripheral. And I said, please explain more. She goes, word for word. I used to be, and she put her hands right on both sides of her face with walls. She says, I can see beyond my hands right now. And I was okay with that in the past. Now I can see everything. And that was overwhelming for her. Yeah. And then we had a chat with you, you talked to her, but now it was like, now she was in her safe space with her periphery. And now the world was wide open, but she's worked with it and her confidence level is a lot more. And personal space is a big change. You want to go a little more about the personal space with this?
Yeah, 100%. So remember, I mentioned that the visual process is pervasive.
Mm-hmm.
Okay, what do I mean by that? Because I didn't understand it when I learned it initially. It's like, if 80%, 60, 70, 80% of the brain is vision like it's the vision is part of the processing.
Yeah.
Okay. And now we don't have an efficient visual system kicking in. Okay. Then we make up for it using other senses. Okay. So for example, and again, this is where I listen to the behavior. Have you ever heard the term when you lose one sense, the other ones get more enhanced?
Yes.
Okay. And I used to think, well, if you lose your hearing, right, that you see better, or that you feel more efficiently. It's not the case. So what happens is when you lose a sense, the other ones get enhanced, but you see brighter, you hear louder.
Yeah. Okay.
Feel more intensely. So you'll hear a child saying, I can't wear clothes that, because it's like, right? Or certain materials.
Oh, yeah.
Okay. Children with that are on the spectrum, right? They shut their ears. Why? It's too loud.
It's overwhelming. Yeah.
So now you say, why are they shutting down the auditory? What's happening in the visual? Okay. So if I see these behaviors right away, I'm evaluating to say where the inefficiencies is the visual space. We good? Yeah. So this is what I mean by the pervasive nature of it. Now, let's say, in this example, your daughter comes in and she has this constricted periphery. Okay, so it's what we talked about, word for word when she's reading and not aware of anything beyond this space. And she's in the car with you. Okay, and she can't see anything beyond her hands, but neurologically, the brain has to attend to any loud noise and movement. And it's a safety mechanism. So when she's in the car with you and a truck blasts by that's loud and fast, how does she respond? Right? There's an anxiety that may show up where somebody's going to say, I feel uncomfortable driving. I'm anxious driving.
Yeah.
Okay. Now, but that's viscerally in her body. Okay. So now where's the anxiety coming from? Well, how about there's a chance that now there's a visual component to this anxiety? Okay. It's not always the case, but let's say in this case there is. Okay. Now we put those lenses to start. So we know that we have a constricted periphery. We put enough prism or plus lenses or filters in order to move the neurology from a sympathetic fight or flight anxious response to a parasympathetic, calmer, open up space. And now she has choice and flexibility in what she's looking at. Okay. And secondly, how to feel.
So it's making her brain realize that she's in a safe environment and we don't need those extra protective mechanisms anymore.
A safety environment with more space.
Yeah. Geez.
So what happens if you're in a small room and you have nowhere to move?
Yeah.
It's called claustrophobia. You freak out. At some point, what happens if all of a sudden that person that's so used to being in a small room, you put them in a bigger room, even if it's a foot more, 2 feet more. Okay. Yeah. What happens though if you put that person in the jungle? Do you understand the safety component?
Well, I already said, you put me in a jungle full of lions. I don't know where they are. I'm going to be anxious and freak out. But if I go to the zoo and there's a cage in between us, I'm calm. Right? Okay.
Yeah. But this is the space component and safety in space is the key element that I'm trying to make a point of here. And then what happens in terms of the neurovisual training? Well, when you're in the bigger room or you have more space, your brain can now adapt to the space. And now what you're doing is training the neurology to know what to do in that bigger space. And then allowing the visual processing to integrate. And that's why I say to patients, these glasses, I hope, aren't going to be needed anymore, because once the brain adapts to that space, you don't have to do it optically anymore.
Oh, so in a way, we're retraining the brain, neuroplasticity. Yes. Okay. Yes. So, so it's another form of therapy in a way. Like for me with my childhood trauma stuff, it's working with little Andre to explain I'm in a safe space, but now you're actually dealing with space now with the eyes is what I'm hearing. Because like you said, the brain creates movement and motion, and the peripheral, this was a eye opener for me, no pun intended. That was not intended at all. But the peripheral vision is key to a safe space, and thinking is also a visual experience exercise. So if we have the lenses or the prisms they're refracting light where they're supposed to be, so I can get the proper communication between my hardware, the eyes, and the software, the brain, correct?
Yes.
Yes. And that, if that creates a safe space for you, what else can you do? It's unbelievable.
Okay, you can
Right.
open
And
up.
like for me, I was reading 5 times slower. Now I'm reading 5 times and I'm comprehending what I'm reading now fast.
Yeah.
Right. And it was just that simple, just a little refraction of the light. So it's amazing how our eyes really dictate, I guess, our space and energy around us. And if we don't quite get that, I like the analogy between hardware and software, right? It's just like, hooking up a PC laptop to a Macintosh printer. They're not going to work well, right? So to me, it's very impressive. So to you, the listener, what do you think your potential would be if you can get this kind of neurovision therapy to create you a safer space for you to excel? And for me, was to grab myself so I can communicate a little better, not reduce the intensity, I think is a good way to put it. Or for you to remove the peripheral walls and then start seeing the world differently. And like I said, with my daughter, she feels a lot safer. She starts going a little further than what she used to be. So, man, this is phenomenal, Stel. I appreciate you sharing this. Where can people find you?
You mentioned, so www.mindseyeoptometry.com is our website. Vision Therapy Canada.com, I think, is the national organization where you could find other people that are doing what I do in terms of the neurovisual piece. COVD.org is the American version of it. But yeah, feel free to, I'm Dr. Nick at drnick.ca or Dr. Nick at mindseyeoptometry.com if anybody has any questions. And my mind's going a mile a minute now because you asked a question in terms of how much does this impact sort of life, and the analogy in terms of the room, right? Like being stuck in the room. And again, I'll use ADD again as an example, but think of the social impact it has on the person. So you mentioned little Andre, right? Mm-hmm. And think of the emotional impact that it has on a person. And again, I'm going to go back to the pervasiveness of the visual process. It also involves the limbic system of the brain, okay, which is the emotional component of it. So if we're constricted in a room and all that fits is us, how do we relate to the world? We don't. All we know is us. When that space opens up, and what we talked about is the space of the room, but what happens if the space opens up and there was always people in there? How do we relate to others?
It's a new skill to learn.
It's a new skill to learn, right? So you'll hear people going, oh my God, he's socially awkward or she's socially awkward. And then, after a few years, they become CEOs of presidents, like, oh my God, they're like the most social people ever.
Yeah.
But it's all part of the process of the individual to discover their uniqueness and greatness. Okay. And even though at the beginning, it's like, well, they were socially awkward in grade 5, now they're like, the models of the world, and it's all part of a process to see. And I like the analogy in terms of the room getting bigger, because sometimes when the room is so small, you have the ability to think about the depth of who you are.
Yeah.
Okay. When that starts opening up wider and wider, and you meet other people that have gone through the same process, this is where I think the magic of collaboration occurs, because then there's a way to exchange information, because there's other people that used to be in a similar box. And I think that's the reason we have the depth of conversations that we do. Yeah. And I'll put it out there because you just made me, come up with an analogy in terms of, why is it that we can relate to some of our stories. And then when you come up with your ideas, how all of a sudden it sparks my idea. It's almost like we go back into the box for a couple seconds and come back out and go, okay, let's play, Andre, let's go.
Yeah. Yeah. And I think that's a great place to end there, because I think that analogy, I'm going to let the listeners mull that one over, because I think that's really reflective to them, to the listeners, and to you, the listener. If this is making any sense to you, and you feel that you're being boxed in, or your potential is being held back, take a look into neurovision, because honestly, it changed the life of my daughter at 16, and then for me at a later stage, it is completely different, and it's just silly plastic now that just changes the way the light is going to my eyes. But it's definitely something to look at. So Stel, thanks again for sharing your expertise here and passion for this.
Thanks, Andre. It's always a pleasure.
And to you, the listeners, thanks again for learning with me. We'll talk to you soon.